welcome to the LA County COVID-19 update conference call. At this time, all participants are in a listen-only mode. Later, we'll conduct a question-and-answer session. Instructions will be given at that time. If you should require assistance during today's call, please press star, then 0. I would now like to turn the conference over to our host, Supervisor Kathryn Barger. Please go ahead.
Thank you. Good afternoon. I'm Supervisor Kathryn Barger, Chair of the Los Angeles County Board of Supervisors. Today, we have several updates to provide, in addition to the latest case count that Dr. Barbara Ferrer will discuss. Dr. Christina Galli, head of the Los Angeles County Department of Health Services, will discuss surge capacity within our hospitals. Kevin McGowan, the head of our Office of Emergency Management, will be here with information on the hotels and motels that the county has secured in partnership with local cities throughout the entire LA County region. He will clarify the uses of these various properties. Finally, we have invited Keith Knox, Los Angeles County Treasurer Tax Collector, to answer questions about property taxes as the deadline for payment is approaching on April 10th. I want to remind everyone that we remain a resource for any questions or concerns that you might have. Please continue to visit our website, covid19.lacounty.gov. Again, that is covid19.lacounty.gov, or follow us on any of our social media places for the latest updates. And now I would like to invite Dr. Barbara Ferrer, Director of Los Angeles County Department of Public Health, to speak and give you the latest count. Thank you.
Good afternoon, and thank you so much, Supervisor Barger. I wanted to really start by thanking all of the residents in LA for following the health officer order, staying off the beaches, not crowding on our trails. I know we asked for a lot, and we really appreciate all of the effort that everyone made to comply and to really do all of the social distancing that was possible. It means a lot to us to have your support, and I think it means a lot in terms of our ability to actually slow the spread of COVID-19. I also want to thank Supervisor Barger and all of the supervisors for their leadership. During these very difficult times, our board has been a strong, positive, and consistent force for all of us who live here in LA County. And I also want to extend my gratitude to all of our county leaders, both those that work in county government and also those that are taking on leadership responsibilities in our communities. This work truly requires cooperation, and I thank you for being such wonderful and collaborative partners. I want to update everyone on our current status here in LA County. I'm really sad to report 7 additional deaths today. 6 of these were people who were age 65 and older. 1 person was between the ages of 41 and 65. 6 of the people who unfortunately passed did have pre-existing health conditions, including the person who was younger than age 65. This does bring the total of deaths here in LA County to 44, and our mortality rate for COVID-19 remains at 1.8%, which is in and of itself a staggering reminder of how deadly this disease can in fact be. Our hearts go out to all of the families that have lost loved ones. Please know that you're in our prayers every day. 86% of the people who were positive for COVID-19 who have died also had underlying health conditions. So again, as we've noted from the beginning, there's serious risk for those people who have illness and are older with the disease of COVID-19. Today, we're also reporting 342 new cases. In the last 48 hours, we've seen 686 new cases, and the total number of cases in LA County now stands at 2,474. These cases include 99 cases reported by our partner in the city of Long Beach and 10 cases reported by the city of Pasadena. About 80% of all positive cases occur in people between the ages of 18 and 65. This has been consistent from the beginning. So while younger people are less likely to be hospitalized and have serious illness associated with COVID-19, younger people are certainly able to become infected and, in fact, infect others. At this point in time, although our numbers continually rise, we do have to assume that there are other people that are infected who haven't yet been tested. So the true number of people infected in LA County is likely to be significantly higher. About 492 cases of people who were positive for COVID-19 were hospitalized at some point during their illness, and this again is about 20% of all positive cases. Of those who were hospitalized, 184 were 50 years old and older, and 46% were over the age of 65. And as I noted, COVID-19 can cause very serious illness in people of all ages, but particularly those who are older. Of the 249 people today who are hospitalized, 26% are in the ICU. 66% of the patients in the ICU with COVID-19 are 50 years old or older, and 61% have underlying health conditions. You can see the full update report of LA County cases on our website at www.publichealth.lacounty.gov. I also want to let folks know that we're investigating COVID-19 cases at 25 different institutions in the county. 18 of these institutions are nursing homes or skilled nursing facilities. And the total number of confirmed cases in all of these institutions is 130, including both staff and residents. I'm also sad to report that of the deaths that have happened recently here in LA County, I am confirming that 6 deaths occurred among residents who were residing in nursing homes. Today, there are 11 facilities that have 3 or more confirmed cases of COVID-19. And for us, this is the mark of an outbreak at a facility. Staff, residents, and family at these institutions have been notified, and these facilities' names are posted on our website. So folks can go there and look. But at this point, there are 11 independent facilities where we're investigating outbreaks. I want folks to know that when there's one case at an institutional setting, our Department of Public Health team does go in, and it works with every facility and the management and the staff to make sure that they're doing the best they can to protect the health of their residents. This includes making sure that infection control protocols, quarantine and isolation protocols are all being followed. Most of the residents who are in facilities where there are cases have in fact been quarantined. I want to talk for a minute about testing. As of March 29th, over 15,500 people here in the county have been tested, and 12% of people tested were positive. And I want to thank Dr. Kazan and his team for improving the ability of folks who need to be tested, symptomatic people who live in LA County to be tested, can now have an easier time getting tested. I also want to thank the hospitals, including our own county hospital, for being able to offer testing to patients. But I do want to remind everyone that testing capacity is still limited, and wait times for testing results can be too long. Therefore, it's critical that we remain vigilant about who needs to be tested, and that you work with your provider if you think that testing is appropriate. Again, testing is recommended only for people who are symptomatic. If you're not experiencing any symptoms, the best thing you can do is stay home. And if you must go out to get some essential services, please practice social distancing measures, staying 6 feet away from people at all times. I know that everyone is doing their part to slow the spread of COVID-19, and particularly want to thank all of our businesses and residents across the county. But the greatest service that everyone can provide at this point is to stay home. Staying home carries with it enormous impact. These are extraordinary times, and I want everyone to note that we need to be prepared for this to go on for a while to come. Please, if you're out and about, make sure that it is only for essential services and that you're not gathering with other people at any time. If you're feeling that you have some mild symptoms of illness, or you've tested positive for COVID-19, or you're waiting for test results, or you've been told by a medical provider that you're likely to be positive, we ask you to make sure that you are self-isolating for 7 days and 72 hours after symptoms and fever subside. This is really important. As I noted before, we have 3 tools: social distancing, self-isolation, and that's for all of the people who may have illness and are waiting for test results, and those who have a positive test result. This is incredibly important to do to keep others from becoming infected. So that means, please, no shopping, no hanging around with others in your household, no caring for children or the elderly, and if you're an essential worker, it absolutely means you should not be going to work. If you're the close contact of someone who's feeling sick, has tested positive, or is likely to be positive, please self-quarantine. That is, stay home and stay away from people for 14 days to make sure that you haven't become infected. And if while you're in quarantine you begin to experience symptoms, you now need to act as if you're positive for COVID-19 and self-isolate. As a reminder, if you're experiencing even mild symptoms and you're an older adult, or you have underlying health conditions, or you're pregnant, please call your healthcare provider immediately to seek guidance. Let's all continue to commit to working together to slow the spread of COVID-19. It requires all of us, every one of us, to do our part, every part of every day. Thank you so much. And I now want to invite up Dr. Galley, the Director of the Department of Health Services.
Hi, I'm Dr. Christina Galley, the Director of the Department of Health Services. Thanks for joining us today, and thanks to all those healthcare workers, first responders, public health officials, elected leaders, so many people who are contributing their time and energy to combating this epidemic. I want to provide today a brief update on bed status of hospital surge capacity and personal protective equipment, as well as talk a little bit about the work that the county is doing to help support our homeless partners in the region. So first, specifically regarding bed capacity and personal protective equipment snapshot. As I've reported previously, the county has approximately 82 acute care hospitals with 22,000 beds located in each one. That includes 2,200 ICU beds. At the current point in time, there are 1,573 beds open. That includes 214 ICU beds. Among the 4 DHS hospitals that are operated within the county system, their current census is 824, with 577 staffed beds currently open. That includes 75 ICU beds. With respect to personal protective equipment, the county EMS agency, which is a part of the Department of Health Services, continues to receive on a weekly basis supplies of PPE from state and national stockpiles. They received a large distribution on Friday and continued to distribute those throughout county hospitals, public and private, as well as first responders and clinics across the region throughout the entirety of the weekend. Regarding ventilators, there are currently 865 unused available ventilators for use on a patient who requires mechanical ventilation. This data is self-reported by the hospitals on a daily basis. In addition to this, the EMS agency has approximately 170 other ventilators in its stock, able to be distributed to hospitals if they face a shortage of ventilators. We're grateful to the state for their help in bringing these ventilators back in service and making them available for use. Additional ventilators are on order, and additional ventilators are also being serviced so that they can also be made available through the EMS agency for distribution to hospitals once they are fully serviced and available. Regarding surge planning, as I've reported previously, all hospitals across the region, public and private, continue to ramp up their surge operations. In any surge, the vast majority of surge capacity will happen within an acute care hospital or on its campus. This is the best way to deploy surge capacity because hospitals have the underlying infrastructure that is needed to support acute care operations. Within DHS's network of hospitals, we have 1,600 licensed beds, currently 1,400 or more staffed beds, easily able to add on those additional 200 staffed beds. And then on top of that, we are in the process of implementing what we refer to as our phase 2 of our surge plan. So just to give you some context, this will include bringing on an additional 220 ICU beds within the DHS hospital system. That will more than double our intensive care unit capacity within the county hospitals. It also allows us to bring on an additional 470 medical, surgical, or non-ICU beds to be able to care for individuals who need acute level of care. Other hospitals across the region in the private sector are also taking similar steps to be able to surge their capacity in both medical surgical services as well as ICU services so that they can care for an expected increase in COVID positive or suspectedly positive patients in the near future. There is also efforts to ramp up additional surge capacity in non-general acute care licensed locations. This includes, as you all know, the arrival of the U.S. Naval Mercy ship on Friday. This ship has docked on Friday and has the capacity to bring online up to an additional 1,000 beds. A large number of these beds are for lower level of care, but about 380 of those beds are for general acute care, including 80 of which are suitable for caring for intensive care patients. The U.S. Mercy, working in partnership with the county EMS agency, completed mock patient transfers this weekend and started accepting their first patients over the weekend. They have established protocols in place to transfer non-COVID positive patients to the U.S. Mercy, and we will continue those transfers in the future. Just again to remind people, the Mercy is a non-COVID positive ship. It is specifically geared to being able to offload hospitals of their patients that don't have and are not suspected of having COVID-19 disease. This still, though, is a critical aspect of the surge plan because it frees up capacity within the general acute care hospital system to have the ability to care for COVID positive patients. There's other efforts underway. The city of Los Angeles is establishing a lower level of care federal medical station at the convention center to care for patients who are ready for discharge from an acute care hospital. The EMS agency is establishing locations for their mobile medical tent system. There are a number of different projects in place to also bring on other acute level of care or lower level of care capacity across the system. Shifting now to homeless services, just to briefly again provide an update about some of the activities that are happening within the county and the county's Housing for Health unit within the Department of Health Services. Housing for Health is responsible for providing permanent and interim supportive housing services for vulnerable populations who are experiencing homelessness and need a safe place to go with wraparound case management and medical support services to be able to maintain and support their health. As part of the COVID-19 response, they are working with the Office of Emergency Management to establish 2,000 quarantine and isolation beds for people who are COVID positive or symptomatic with symptoms possibly consistent with COVID and who are not able to self-isolate at a home. This includes staffing and opening up the first quarantine and isolation site at Dockweiler, providing training and technical assistance to providers on the front line who are caring for individuals experiencing hopelessness, managing stocks and supplies of personal protective equipment for homeless service providers who are on the front lines, and also setting up remote or telehealth operations so that providers can limit face-to-face contact to the extent feasible. In closing, hospitals are working well to get underway their additional surge capacity that is needed to care for a potential increase in patients. But social distancing and adequate quarantine and isolation, as Dr. Ferrer has described, is still the most critical step that is needed to help make sure that the volumes of patients can be safely cared for within the healthcare system and that the healthcare system is not overwhelmed with a volume of patients. So please continue to practice social distancing, follow the quarantine and isolation orders as given by public health officials or by your own personal provider. It's by doing this that we can make sure that the hospital system has the capacity to care for those who need it. With that, I'll turn it over to Kevin McGowan, the Director of the Office of Emergency Management.
Thank you, Dr. Galley. Kevin McGowan, the Director with the Los Angeles County Office of Emergency Management. As we continue to see this significant increase in COVID-19 patients, we're taking continued aggressive steps to help individuals and help them now. The county's goal has been to provide approximately 2,000 medical sheltering beds to people who either have been exposed to COVID-19 or, according to public health authorities, have been determined the need to self-isolate or quarantine, but may not be able to do so on their own. So we've been partnering with motels and hotel owners, along with recreational vehicle organizations, to find many assets that the county can bring to bear to provide this medical sheltering solution. As a result, more than 900 medical sheltering beds are now available throughout Los Angeles County, and this has been in conjunction with all of our local partners. More than 1,000 beds will also be added as we continue to build this capacity. Currently, we're serving 45 guests in these medical sheltering sites, and the number is sure to increase over the next few weeks as the growing need continues throughout our community. And it's important for us to continue to remember that this is a community-wide event, and we wouldn't be successful at these medical sheltering sites without the support of all of our community members. As Dr. Galley had mentioned, this is a whole community approach, and we're realizing the need to utilize all of our sources, not just in health services, but in all of our wraparound services, to include feeding and donations and security and support for people who are experiencing this. In addition to that, the county continues to provide many efforts to increase our sheltering capacity for people experiencing homelessness. We're currently working with our federal, state, and local partners to rapidly increase sheltering capabilities that are also going to utilize hotels and motels on the orders of thousands. Currently, we've been in the first phase of contracting with those hotels, and we continue to bring those up online in an immediate fashion. The goal right now is to provide at least 3 sites rapidly over the next couple weeks, which would increase our sheltering capacity by over a few thousand, and that those wraparound services would continue to be provided, but it's a very distinct difference from our medical shelters. And so currently we have this 2-pronged approach to increase shelter capacity, both for people who are experiencing homelessness, but then in addition to that, medical sheltering capabilities. And with that, I would be happy to turn this over to the director from the tax collector, Keith Knox.
Thank you, Kevin. I'm Keith Knox, Treasurer and Tax Collector for Los Angeles County, and the property tax deadline on April 10th is coming up, and we've received a lot of calls and emails regarding whether or not we are going to extend that deadline. The April 10th deadline is established in state law, and we do not have the authority to extend it. However, the county, from the Board of Supervisors to my office, the Treasurer and Tax Collector, has a long history of working with residents and property owners during times of emergency, disaster, and individual hardships, including our recent wildfires the last 2 years. The COVID-19 crisis is no exception. Property owners affected by COVID-19 may have late penalties canceled if they are unable to pay their property taxes by April 10th. Before I describe that process, I do want to encourage all property owners that can pay their taxes online on time to do so. This is a critical source of revenue that helps keep the government running and providing vital services that the public relies on, including emergency response, public health and hospitals, public works, and our schools. Property owners who are unable to pay on time for reasons related to COVID-19 may submit a request for penalty cancellation online beginning April 11th, the day after property taxes are due. My staff will review the circumstances affecting their ability to make a timely payment and cancel any penalties on a case-by-case basis. Please note that county buildings are currently closed to the public, and therefore we are not accepting in-person payments at this time. However, taxpayers can pay online, over the telephone, and through the mail. There is no cost for e-check payments online. However, there is a 2.25% service fee that our card processor charges for credit and debit card transactions. Please visit our website for our many self-service options and our frequently asked questions regarding COVID-19. As always, we will work with taxpayers who are facing hardships as a result of COVID-19, and while we continue to protect the stability of our county finances and services. And I'd like to thank you, and we'll now open it up to questions.
And ladies and gentlemen, from the phone lines, if you wish to ask a question, please do press 1, then 0 at this time. And our first question will come from the line of Claudia Pisciuta with KNX News Radio. Please go ahead.
Hey, Claudia.
Hi, thank you. Hi, I have a few questions. Barbara, if you could please talk about what the average wait time is on getting test results right now, and when that might be, shortened. Also, if you could talk about the inmate who tested positive at Twin Towers and the 4 people who work in the jail who've tested positive, and mentioned if there have been any positive cases in the homeless population. And we would also like to get updates on the positive cases in the Sheriff's Department and the LA County Fire Department, as we're getting from LAPD and LAFD on a daily basis. Thank you.
Yeah, thanks a lot, Claudia. Let me see if I got them all, and I'll try to get through them. So the average length of time that it's taking for test results to get back to both us and obviously providers and patients is between 5 and 6 days. Now, there are clearly differences, and I want to really extend my thanks and appreciation to all of the hospitals that opened up their own labs, because they are able to process on a much, much shorter time frame, and it really makes a huge difference to folks who are seriously ill to get those positive results as quickly as possible. But particularly for some of the commercial labs, they're still struggling with this is the average, which means that we have had cases where people have waited 10, 12 days before they've gotten their results back. And everyone is working hard to make sure that doesn't continue to happen. But it is a reality still, which is why we ask folks that it's not just about can you get tested, it's really about do you need to get tested. And we really need to make sure that the folks who need to get tested are getting tested. And so where there's a provider who needs a patient to be tested for clinical management of the case, that's most essential. And as you know, I reported on outbreaks in institutions, and again, in those institutional settings where we have very vulnerable people, we need fast turnaround times there as well. So we appreciate everyone's patience on this, but you're absolutely right. We still have some long wait times for lab results, and we need to get that number down. The second question was about positive cases in the jail. Yes, we do have one positive case of a person who was in the jail. That person's no longer there and is receiving care at a medical facility. And there have been 4 cases, I believe, of it's either 4 or 5 of staff members who work at the correctional institutional facilities who have tested positive. All are obviously isolated at this point, and close contacts are quarantined, as well as, our teams along with correctional health from DHS and the Sheriff's Office are doing everything we can to make sure that any exposures, either for staff or for inmates, are being handled appropriately. And I want to say it's a great staff that works at the jails, and they have a lot of experience managing outbreaks. So I have a lot of confidence that they're working really hard to prevent there from being any additional cases. You also asked about positive cases amongst people who are homeless. We do have 2 people experiencing homelessness that are known to us to be positive. They're also in isolation. Their close contacts are being identified and are being quarantined. And we also know that there's one staff person who has worked in some of the interim housing for homeless, providing services for people experiencing homelessness, that is also tested positive. Again, our teams investigate all of these cases and make sure that we're moving quickly to isolate people who are positive and offer other people appropriate quarantine situations. So I think.
Are the cases all in Twin Towers?
I can't answer that question now. We can try to get that information back to you later.
Okay.
I just don't have the answer on me right now. I'm going to.
Okay, and I'm wondering if the supervisor could talk about, if any further efforts will be made to reduce the jail population more quickly, given that we're already starting to see cases there.
Yeah, and actually, Sheriff Villanueva could go through that. He's got a plan in place and is coordinating actually with our Office of Diversion to ensure that when people are released, they have housing in place, because that was one of the concerns, is not just releasing, but making sure that they've got secured housing. So I know that Sheriff Villanueva and his staff have been working closely with our Director of Health Services as well as our Office of Diversion to ensure that there is something in place. But he could give you better step-by-step in terms of how they're going about doing the releases. So thank you. Next question.
Next in queue, we'll go to the line of David Rosenfield with LA Daily News. Please go ahead, David.
Yeah, hi. Thank you very much. I was wondering, can you confirm whether any healthcare workers have contracted the coronavirus, and if so, how severe those are? And also, what is your message to hospitals and other healthcare facilities as far as what they should be reporting publicly? Because a lot of them are saying that they're sending information to you guys, but then, the information from you all is somewhat limited. So I'm wondering, what message you have on that type of information?
Yeah, thanks a lot. We have dozens of cases amongst healthcare workers, and we investigate them all. We work with all of the different institutions where they're working to make sure, again, that we're quickly identifying any possible exposures and working with the healthcare facilities to make sure we're appropriately managing any exposure situations. But yes, we've had dozens and dozens of cases amongst healthcare workers. And it's a good opportunity to remind all of us to be so grateful for the dedication of all of our healthcare workers. They really do put their lives on the line every single day. They're taking a lot of risks, caring for people who are often very sick and need elaborate and close contact in the care that's being provided. So we owe them a debt of gratitude for being on the job and doing such a good job. But we do have a lot of cases. I think we do post as much information as we have. We've never listed individual hospitals as being places where, 4 people are at this hospital. It doesn't really serve the public's interest to provide that information. All of our hospitals do an excellent job around infection control. All of our hospitals are working with Dr. Galley and her team around surge capacity. And we have a lot of confidence that the system is working well. But feel free to talk to our team if you were looking for some particular information. But we'll go on to the next question.
And next in queue, we'll go to the line of Steve Gregory, KFI Radio. Please go ahead.
Hi, Barbara. Good afternoon. The convention center last night, LA Mayor Garcetti said that it was being converted into a field hospital, and he was going to defer to your department in terms of how it would be utilized. Could you talk a little bit about how you're going to decide whether it's COVID-19 patients or non-COVID patients or a mixture? He had indicated it might be a mixture of both. Also, what will be the limitations of what can be done in that type of a field hospital? Also, some municipalities around the country are restricting the sale of tobacco and vaping products because of this being a respiratory issue. Wondering if you're addressing that. And also, with respect to my colleague Claudia's question, no one ever talked about whether or not LA County Fire and LA Sheriff would be releasing their stats soon and why they're not releasing them. Thank you.
So on the first part of the question regarding the convention center, we're going to have Dr. Christina Galley discuss that so we can get some clarification in terms of what that is. So why don't you come on up, Dr. Galley?
Hi, so this is in regards to the LA Convention Center. The city is the lead, so it would be great to direct the specific questions about process and status and planned opening date to them. I will say that we are working closely with their teams. The county serves an advisory role to this particular facility, with the city in the lead role as operator. The intended scope of the facility is for individuals who are ready for discharge from a hospital, who are likely COVID positive or suspected to be COVID positive, but need quarantine and isolation, along with some medical recuperative care services until they're ready to go home or to a shelter facility.
Yeah, thanks for the question around limiting the sales of tobacco and vaping. I do want to note that, starting in May, there is a prohibition on the sale of any flavored tobacco products in all of the unincorporated areas, and that many of the cities have also adopted bans as well on the sale of flavored tobacco products. But I do like the attention you want to give to the fact that, there is some evidence that continues to come forward about folks who are smoking being at higher risk, or vaping being at higher risk for serious disease if they are infected with COVID-19. We're obviously looking very closely at those research studies, anxious to get more evidence, and with more evidence, I think you'll see us certainly do more alerts to folks to inform them of the link between smoking and vaping and serious disease associated with COVID-19. Oh, yeah, so I will check with the reporting mechanisms that are in place for both the fire department, LA County Fire Department, and the Sheriff's Department, and we'll be able to get back to you on that as well.
Thank you.
Thank you. Next question.
And next, we'll go to the line of Dave Lopez with Channel 2, Channel 9 News. Please go ahead.
Hi, Dave.
Yes, Doctor. Thank you very much. Two quick questions, if I may. Over the weekend, we heard so much about projections and what the scale shows and what have you. And again, I know 686 in 24 hours. Should we be prepared, we as a city, county, for you to one day come up there and say, today we're reporting 2,500 new cases and 75 deaths? Is that day coming in the next 2 weeks? And my follow-up question would be, how soon, if at all, will antibody testing be begun?
They're both great questions. Let me do the antibody testing. So, there is capacity right now. It's a seroprevalence test, and we're actually waiting for approval to do some community seroprevalence testing using an antibody test. I just want to differentiate that that's a test that really tells us whether you ever saw COVID-19, not whether you're actually infectious at the moment. So it's a different test than the molecular test that we're using now. That really tell us whether you're sick and infectious at this moment in time. In terms of the modeling, I wish I had the answer, and I wish I'd be accurate if I gave you the answer. I do think it's appropriate for us to be prepared to have us announce that we had a huge increase in both the number of positive cases, as you said, over 1,000, and a huge increase in the number of deaths. I think we're all doing everything we can so we don't get to that date. But I can promise you that if that does happen here, we're going to be prepared. I'm training another 500 people on our team at the Department of Public Health to help with investigations and case notifications, so that if we were to get large numbers of new cases in one day, we would still have a system in place to be able to contact people and give them advice about what they need to do if they're positive. And we would still maintain our capacity to do investigations at all institutional settings. So yes, we're going to prepare for that because that's what we've seen in so many other places. But I want to thank the public for doing everything we can in hopes that that isn't the story here in LA. So thanks for that question.
Okay. Doctor, if I may.
Next question.
Next, we'll go to the line of Patrick Healy with NBC Channel 4. Please go ahead.
Thank you very much. If I could follow briefly on that modeling question, the Institute for Health Metrics at the University of Washington is predicting that forecasting April 26th as the peak of the epidemic in California. Is that consistent with LA public health data, what you were getting from CDC?
Yeah.
Two other quick questions, if I could. In terms of the group living and care living situation, since those patients are already quarantined in their rooms, is there anything further that can be done to stop those outbreaks? And finally, a question related to the phenomenon of restaurants that are functioning as grocery stores to try to keep their doors open, but they lack a specific grocery store permit. Is that a serious enough issue that it should continue to be enforced, that they cannot allow people inside to pick up groceries because they don't have that particular permit?
Yeah, thanks. Those are all very important questions. So let me just start with the modeling. We've been working with both the Department of Health Services and UCLA doing some modeling ourselves here. There's lots of modeling opportunities out there. There's lots of different models, as you noted. I think in general, since the inputs are the same, we all have the same data points at this point, I think our results are going to be fairly consistent. And I think we are anticipating that we could, again, as is being predicted, see a peak towards the end of April. But I'd want to wait on making sure that we look at what is very specific for LA County, and people are working on that right now, and hopefully we'll be able to share that with you all at the end of the week. So, I appreciate everyone's need to really look at the modeling and see what it forecasts for us, but I do also want to note that it's just a forecast, and that every single day our team looks at every single data point we have to try to predict what we should be preparing for. So thanks for that question. In terms of the issue on outbreaks in institutions, it's obviously of great concern to us. The first thing we did here in LA County is we sent out teams weeks ago to meet with all of the nursing homes, all of the long-term care facilities. We've done most of the assisted living facilities and now are doing some webinar training for them so that folks can be prepared about what's the best possible way to avoid an outbreak in your institution. We also did the same for all of the shelter providers and interim housing providers. Now when there is one case, so at the first sign of a case in a facility, we send another team out to work and really, as you noted, make sure that we're trying to prevent as much transmission as possible. But as you know, oftentimes there's an employee or staff person who may unknowingly have been infected, may have infected others, because they care for a large number of people, and that's why everyone's under quarantine. As soon as somebody becomes symptomatic, they're moved into an isolation situation and obviously transferred to a hospital care should they need more advanced care. And in terms of your last questions, restaurants as grocery stores, no, it's not really possible for a restaurant to become a grocery store. So I want to just clear that up. You cannot just decide you're going to now sell groceries. I appreciate all of the innovation, but grocery stores are licensed. And anybody who wants to be a grocery store does need to get licensed. So we're working with the grocery stores. We're working with the restaurants so that they understand that they can do a lot of takeout and provide a lot of opportunities for people to get food through their takeout services, but no, they don't get to open as a grocery store. So thanks for the question. We'll take the next question.
Next in queue will go to the line of Joel Grover, NBC Channel 4. Please go ahead.
Actually, Doctor, my colleague Patrick Healy just asked the question that I had, which is about restaurants struggling for their survival and to keep their employees. I think you mostly answered it. But my question comes from a restaurant owner. He said he will keep social distancing in his restaurant. He will keep customers 6 to 10 feet away, only allow 2 in at a time. Why not allow someone like that to operate as a walk-in grocery store if they're going to enforce strict social distancing?
Because grocery stores need to be licensed as grocery stores. So I think it's a pretty straightforward answer.
Thank you.
One more question.
And we'll go directly to the line of Stephanie Dazia with the Associated Press. Please go ahead.
For doing this again. So you mentioned, Dr. Furr, that you're predicting a peak at the end of April. The governor just said that they're predicting a peak toward mid-late May. Why the difference? Obviously, LA County is unique. But why the difference, and what kind of numbers are we looking at? What is our peak considered to be?
No, these are all good questions, and I was really trying to say, we're going to have a full report at the end of this week on sort of modeling using our own numbers. The truth of the matter is none of us really know. We're all making the best guess that we can using the different modeling techniques that are available. We see an acceleration both in the number of people who are being tested. We've moved now from about 10% of people being tested at the beginning were positive to 12% of people being tested now are positive. We've looked at our hospitalization rates. We've looked at the acceleration. This will be actually a very important week for us as we see whether or not we continue to double or triple in short periods of time. And those are the numbers that are needed to actually be able to accurately or more accurately predict what the peak will be. You know, it's also hard because nobody has seen this virus before here. So when you think about everybody's ability to get sick from COVID-19, it's pretty high. Most of us have no immunity for this, and that also needs to play into the modeling. I think what I really am very, very grateful for is the seriousness at which all of the residents are taking the social distancing, the isolation, and the quarantine measures. And obviously, those are measures that will dampen our curve. So if we're really good at this, and I think we're doing everything possible to be good at this, we might have a different trajectory here in LA County. I don't know for sure, but that's the hope I offer. Let's get really good at what we know we can do to dampen the curve. Thank you.
Okay, so that ends the questions. We're now going to have remarks in Spanish. Dr. Furr?
Buenas tardes a todos. Quiero comenzar agradeciendo a los residentes del Condado de Los Ángeles por seguir el orden del oficial de salud y permanecer fuera de todas las playas. Pedimos mucho y realmente apreciamos la ayuda de todos. También quiero agradecer al supervisor Barger y a todas las supervisoras por su liderazgo. Durante estos tiempos difíciles, ustedes han sido una fuerza fuerte, positiva y constante para todos nosotros. También quiero agradecer a todos nuestros líderes en todo el condado de Los Ángeles. Este trabajo realmente requiere cooperación y les agradezco por ser socios colaborativos. Para actualizarlo sobre nuestro estado actual. Estamos tristes de reportar 7 muertes adicionales hoy. 6 de ellos eran personas mayores de 65 años y una persona tenía entre 41 y 75 años. 6 de las personas tenían comorbilidades, incluyendo la única persona menor de 75 años. Esto eleva el número total de muertes a 44 en el condado de Los Ángeles. Y nuestra tasa de mortalidad para el COVID-19 es 1.8%. El 86% de las personas positivas para COVID-19 que murieron tenían condiciones de salud. Para todos aquellos que están afligidos por su familiar o un amigo perdido por COVID-19, lamentamos mucho su pérdida y los mantenemos en nuestros pensamientos y oraciones. Hoy también estamos reportando 342 casos nuevos. El número total de casos del condado de Los Ángeles ahora es 2,474. Alrededor de 80% de todos los casos positivos ocurren en personas entre las edades de 18 años y 75 años. Este ha sido un número constante desde el principio. En este punto debemos suponer que hay muchos más casos que están todos en el condado de Los Ángeles. 492 casos han sido en algún momento hospitalizados. Esto es 20% de todos los casos positivos. El total tenemos también, te voy a reportar hoy en casos de entornos institucionales. Estamos investigando 25 entornos institucionales que tienen al menos un caso confirmado de COVID-19. En total de casos confirmados en todos los entornos institucionales en el condado, por este momento es 130 personas. También te voy a dar un poco de información sobre las pruebas. Hasta ayer, más que 15,500 personas han sido evaluados en el condado de Los Ángeles y el 12% fueron positivos. Quiero agradecerle a todos los que están haciendo su parte para frenar la propagación del COVID-19. Y ahora, ahora viene a hablar el señor Knox, que es el director, Treasurer and Tax Collector.
Buenas tardes. Disculpen mi español. Soy Keith Knox, el tesorero y recaudador de impuestos del Condado de Los Ángeles. La fecha límite para pagar los impuestos de propiedad se aproxima el 10 de abril y hemos recibido llamadas y correos electrónicos preguntando si vamos a extenderla. La fecha del 10 de abril está establecida en la ley del Estado y no tenemos la autoridad para extenderla. Sin embargo, el condado, desde la Junta de Supervisores hasta el tesorero y recaudador de impuestos, tiene una larga historia trabajando con los residentes y dueños de propiedad en casos de emergencia, desastre y dificultades individuales, incluyendo los recientes incendios forestales en los últimos años. La crisis de COVID-19 no es una excepción. Los dueños de propiedad que sean afectados por COVID-19 pueden obtener cancelación de las multas si no pueden pagar sus impuestos a tiempo. Quiero pedirles a todos aquellos que pueden pagar sus impuestos de propiedad a tiempo, lo hagan. Esta es una fuente crítica de ingresos que ayudará a mantener al gobierno proporcionando servicios vitales en las escuelas y el público confía como las respuestas de emergencia, la salud pública en nuestras escuelas. Las personas que no pueden pagar a tiempo por razones relacionadas al COVID-19 pueden someter una solicitud de cancelación de multa en línea a partir de 11 de abril. Mi personal revisará las circunstancias que afectan su capacidad para hacer su pago a tiempo y cancelaremos multas caso por caso. Tengan en cuenta que todos los edificios del condado están actualmente cerrados al público y no aceptamos pagos en persona. Sin embargo, pueden pagar en línea, por teléfono o por correo. No hay ningún costo para los pagos de cheques electrónicos en línea. Para pagos con tarjeta de crédito débito, nuestro procesador cobra una tarifa del servicio del 2.25%. Consulte nuestra página web para obtener más información. Gracias, and we will now open it up for questions. Estamos listos para sus preguntas.
And our first question will come from the line of Jim Roop, Westwood One News. Please go ahead.
Hi, thank you very much, and thank you again for taking our questions. We really appreciate that. My question is in regard to the lag time in test results coming back. You said 5 to 6 days, sometimes as late as 12 days to get the results back. Yet we're seeing celebrities and elected leaders talking about a one-day turnaround, two-day turnaround. The entire Los Angeles Lakers team was tested on Wednesday the 18th, and on Thursday the 19th, we were reporting there were 2 positive cases among the team members. So why is there such a disparity between some results that come back and then the results that you come back that are saying it's taken maybe almost 2 weeks to get them back?
Yeah, I think it's a really good question. I mean, I do want to note at the very beginning, the test result turnaround times were much shorter because there weren't as many people getting tested. So even, here in LA County, we were reporting much quicker turnaround times at the beginning. I think as capacity has increased, I'd say there are probably 2 things that are going on. One is that the commercial labs are still trying to figure out how to do this best. given the demand, and they have lots of new clients. So I think they're trying to work out their own systems, and I feel really hopeful that they're going to be able to do this quicker and have more capacity to actually process the specimens. I mean, I know for our lab, we ordered 2 new machines, like 3 weeks ago, and they're on back order, and so we haven't been able to increase our capacity at our own, the small lab, the public health lab, and I think that contributes to some of the slow turnaround times. It's just everyone getting up to speed, and we're behind. I mean, it's completely, a problem that can get solved. I know that there's issues with some people having better access than others. I think that's really unfortunate. I think our job here at the county is to make sure that everybody has the access that they need to testing when it's required by their provider, and that the turnaround times get much shorter, and that's what we're working on. So thanks for that question. We'll go on to the next question.
Next in queue, we'll go to the line of John Klimak with NBC Channel 4. Please go ahead.
Hey, guys, I know it might be somewhat early to be talking about this, but my question has to do with if there's been any discussion into needed infrastructure or plans that would need to be put into place before we were to get back to somewhat normal lives again. Following 9/11, we got TSA. What are we seeing that could be the new normal once we get to that point and things start opening up again?
Yeah, I appreciate that question. I'm going to ask Mr. McGowan to come forward and sort of answer how the county does its planning. But what I really appreciated was your acknowledging that it's not a switch-on, switch-off situation. We're not one day here with a lot of restrictions and then tomorrow we have none. And so, but Mr. McGowan has been doing an amazing job bringing everyone together to do that planning. So I'm going to turn it over to him.
Thank you, Dr. Furr. As we continue to move forward in this, we've already begun our recovery planning process, and our recovery planning process includes all of the stakeholders that have been a part of this initial response. And there's a continued effort to identify what areas are in most need for recovery and to provide those outputs, both from the governmental sector, the private sector, and then as residents and the public. And so you can go to our lacounty.gov website and find resources available. But in addition to that, we're going to have to continue to rebuild what the new normal will look like after we find ourselves on the backside of this event. And that's both from a financial standpoint to make sure that we can continue to provide critical functions and services as the government, and then also to partner with our private sector businesses to ensure their rapid return to a new normal of business.
We'll take the last question.
And our final question will come from the line of Colleen Shelby with the Los Angeles Times. Please go ahead.
Hi, thanks for taking my question. I'm just wondering if you have a recovery count at this point, and if so, if those numbers are being subtracted from the overall case counts in LA County.
You know, we're trying to get a better, I don't want to say better, we're trying to get more accuracy in the recovery counts, which are a little bit harder for us to track than data on hospitalizations. So we're working on that, and at whatever point we feel like we have an accurate count of that, we'll be posting that on our dashboard every day. But it's a good question, and we're working on just getting more accurate information. Thank you. So I want to thank everyone. This concludes our press briefing, and we appreciate, again, all the media that have accurately been reporting on COVID-19. So thanks a lot.
And ladies and gentlemen, that does conclude our conference for today. We thank you for your participation and for using the AT&T